Welcome to MedSimpleTv. Today, we're talking about cholera, a serious but preventable disease that continues to affect millions of people around the world, especially in areas with poor sanitation and unsafe drinking water. In this video, you'll learn what cholera is, its causes and transmission, risk factors, symptoms, diagnosis, treatment, management, prevention, and why education and early action are so important. Let's begin.
Cholera is an acute diarrheal disease caused by a bacterium called Vibrio cholerae. It spreads mainly through contaminated food and water. Once inside the body, the bacteria produce toxins that affect the intestines and cause severe watery diarrhea. Cholera can lead to dehydration very quickly, and if left untreated, it can become life-threatening within hours. Although cholera is preventable and treatable, outbreaks still occur in many developing countries where access to clean water and sanitation is limited.
Who is at risk? Certain groups of people are at higher risk of cholera. These include people living in overcrowded communities, refugee camps, areas affected by floods or disasters, in places with poor sanitation systems, children under 5 years old, elderly individuals, malnourished people, and those with weakened immune systems may develop more severe illness. Poor hand hygiene and lack of access to healthcare. Travelers visiting areas with active cholera outbreaks can also become infected if they consume unsafe food or water.
Transmission of cholera. Cholera spreads mainly through the fecal-oral route. This happens when food or drinking water becomes contaminated with feces containing the cholera bacteria. Common sources of infection include untreated water, raw or undercooked seafood, unwashed fruits and vegetables, and poor hand hygiene. The disease can spread quickly during outbreaks, especially in communities without proper sewage systems or clean water supplies.
Incubation and symptoms. The incubation period for cholera is usually between 12 hours and 5 days after exposure. Some infected people may not show symptoms, but they can still spread the bacteria. Common symptoms include sudden severe watery diarrhea, vomiting, muscle cramps, thirst, dry mouth, weakness, and rapid dehydration. The diarrhea is often described as rice water stool because of its pale, watery appearance. Without immediate treatment, severe dehydration can cause shock, kidney failure, and even death. Diagnosis and fatalities. Doctors diagnose cholera based on symptoms, patient history, and laboratory testing. A stool sample is commonly tested to identify the cholera bacteria. Rapid diagnostic tests may also be used during outbreaks. If left untreated, cholera can have a very high fatality rate due to severe dehydration and electrolyte loss. However, with proper treatment, the death rate can be reduced to less than 1%. Challenges, emotional effects, and counseling. Cholera outbreaks create many challenges for families and communities. Patients may experience fear, stress, embarrassment, or social stigma. Communities affected by outbreaks may struggle with lack of clean water, limited healthcare access, poverty, and overcrowding. Counseling and health education are important during outbreaks. Healthcare workers help patients and families understand how the disease spreads, how to prevent infection, and why early treatment is essential. Community support and awareness can reduce panic and encourage people to seek medical care quickly. Screening, treatment, and managements. Early screening and treatment save lives. Most patients are treated with oral rehydration solution, also called ORS. Severe cases may require intravenous fluids in the hospital. Healthcare providers also sometimes prescribe antibiotics like doxycycline, erythromycin, or azithromycin to reduce the duration and severity of the illness. Zinc supplements are especially helpful in children. Patients should continue eating and drinking safely during recovery. Good medical management and quick response during outbreaks can dramatically reduce deaths.
Prevention, management, and education. Cholera prevention starts with clean water, proper sanitation, and good hygiene. Important prevention measures include washing hands regularly, drinking treated or boiled water, eating properly cooked food, using toilets properly, and improving waste disposal systems. Oral cholera vaccines are also available in some high-risk areas. Education is one of the strongest tools in preventing outbreaks. When communities understand how cholera spreads, they can protect themselves and others. Remember, cholera can be dangerous, but it is preventable, treatable, and manageable with early action.
Thank you for watching this video. If you found this video helpful, like, share, and subscribe for more easy-to-understand medical education videos. Stay informed, stay healthy with MedSimpleTv.